Welcome to my channel Learnovate. In this video, we will going to discuss about the male genital organs. The external genitalia of male that includes the testes, scrotum and the spermatic cord continues with the epididymis and the rectus differentia. We will going to discuss the gross anatomy of all these structures, starting from the presence of the testes in the scrotum. So as we can see here in this diagram, this is showing the two testes present in the scrotum that is suspended by a spermatic cord that attaches the testes to the abdominal cavity. These hanging testes are the left testis is somewhat lower than the right one. The testes are the male genital organs and they are ovoid gonads that produce the sperms and also produce the male testosterone hormone that is passing from the epididymis towards the different genitalia of the male, and at the end it will produce in the extra ejaculatory duct, and then it will be excreted out through the penis towards the exterior of the body. So we will going to discuss the anatomy of the testes. In this diagram we can see that the testis is suspended in a layer of fascias, and these layer of fascias are formed by the hanging cutaneous sac of the scrotum. This scrotum that is present outside the male body is having three layers: the detrusal fascia, the cremasteric fascias and the fascias that covering the scrotum. Then the scrotum is divided internally and it will going to present over the testes and cover the testes outside. This scrotum is an heavy temperature and highly pigmented skin for the testes to remain normally and produce the sperms. Now the testis that is present inside is itself covered by two layers of fascia. The tunica vaginalis of the testis having the two layers. The visceral layer is connected with the testis itself, and the parietal layer of the tunica vaginalis is covered with the fascia of the scrotum. The tunica vaginalis, the visceral layer of tunica vaginalis covering over the testis, epididymis and the vas differentia. Then inside the tunica vaginalis, if we open the testis, we can see another layer that is the tunica albigina. It is a thick fibrous coat covering over the testis. Continuous with the tunica albigina is the layer of the fascia covering the spermatic cord, and that will going to supply the vasculature of testis. So if we going to cut section the testis, what we can see inside the testis. So here, after removing all the layers of testis, this is the tunica albigina remain on the testis, and the inside internal anatomy of the testis can be seen here. The testis on the posterior side having a meshwork of trabecules called as the mediastinum testis. The mediastinum testis will going to radiate the septas into the testis, dividing the substance of testis into the lobes and the lobules. The lobules of the testis having a highly coiled tubules. These tubules present the lobules of testis are called as the seminiferous tubules. That elongates and become the straight seminiferous tubules that is called as the rete testis. And this rete testis that are actually the straight seminiferous tubules are present in the mediastinum testis of the testis. So the mediastinum testis having the rete testis that converge posteriorly as the efferent tubules. These efferent tubules after converging on the one side and they continue as the ductus epididymis. From the efferent tubules, the sperms that are produced in the seminiferous tubules passes into the straight tubules and then into the rete testis of mediastinum testis. And from the rete testis, the sperms will eventually going to pass from the efferent tubules into the duct of the epididymis. That starts from the head of the epididymis, then continues with the body and the tail of epididymis. From the tail of epididymis, the sperms will going to pass through the ductus differentia, that is a continuous duct from the epididymis. And what happens, this ductus differentia with the vasculature of the testis will going to pass through the spermatic cord that will suspend the testis with the abdominal cavity. So the spermatic cord that enters the abdominal cavity in the pelvic region contain these structures. That includes the efferent ductule, the pampaniform plexus of vein, that is the plexus of veins present in the spermatic cord providing a thermoregulatory system for the testis. The testicular artery will also going to pass through this spermatic cord with the ductus differentia and the testicular vein. The testicular artery is a branch of aorta and it will going to supply the arterial supply of the testis, while the testicular veins are going to enter into the inferior vena cava, while the left testicular vein enter into the left renal vein, and they will going to drain the venous drainage of the testis. So the arteries supply venous drainage, and also the sympathetic trunk, the genitofemoral branch of the femoral nerve, also present in this spermatic cord. So you can say the vasculature including the artery, vein, nerve, tympaniform plexus and the ductus deferens, these all things are present in the spermatic cord that enters the pelvis through the deep inguinal ring and exits through the superficial inguinal ring. So when it enters, the spermatic cord will enter into the pelvis and it will going to drain in following structures into the abdominal cavity. So in this way the testis is hanged and testis is going to innervate the areas, and also the sperm will going to pass into the ejaculatory duct. So this was about the anatomy of testis, how the testis is present in the spermatic cord in the scrotum. I think you will be well explained. If you have any query, comment below. Thank you for watching. Subscribe for more. Like, share and comment on our Facebook page too. Thank you for watching.